let's talk about the Master of Family Medicine program. Um, let's start by asking the question, why study family medicine? Well, this is a quote from Margaret Chan, the then director of the World Health Organization. The quote is actually from quite a few years ago, 2013, I think. And at that time, Margaret Chan said, "Primary care is our best hope for the future. Family doctors are our rising stars for the future." I encourage all of you to continue to cultivate the human side of medicine. And the reason that we present this quote is that this was really the start of a sea change in global health approach to primary care and family medicine. And now, 10 years on from when Margaret Chan said this, family medicine and primary healthcare is very prominent in terms of global health approach, and it feeds into global health policy and government policy in many countries. And I'm sure you will have seen that coming through in your own countries. I hope you have anyway. The Sustainable Development Goals, for example, mention universal health coverage, and fundamental to universal health coverage, or the provision of this, is strong primary care, with family doctors being central to providing that. So that is the first reason why you should study family medicine, in that it will be an increasingly prominent and important medical specialty going forward. The other reason is that the study of family medicine involves very important generic skills that will help you in everyday practice of medicine. And we're talking of skills such as patient-centered consultations, shared decision-making with patients, holistic approach to care. And these are skills that will be beneficial to you in your practice as you move forward during and after the study of this program. So you will see some of the things that I've mentioned there in our program mission statement and in our program goals. So our mission as a program is to develop the specialty of family medicine that delivers to the goals of primary healthcare and universal health coverage. But importantly, what we want to do is empower and equip individuals to promote the development of compassionate, values-based and academic family medicine. So we want to take you as an individual and empower you and equip you with knowledge, skills and attitudes that will enable you to practice family medicine to a high standard. And the inclusion of compassion is something that we felt was very important. It's a focus of our university, and there's lots of work going on within the university on the academic side of compassion and how that influences particularly healthcare. We want you to focus on values and values of a family doctor, your own personal values and how these might develop as you study on our program. And we want to emphasize that we do not only look at the sort of clinical side of family medicine, but this is very much an academic program. It's a traditional master's degree, so that comes with a certain level of academic study. And we will develop academic skills such as academic writing, critical review and reflection, critical appraisal, those sorts of skills. And that's where our program differs from many other master's programs in this field. The program goals, just to go through them, I've mentioned compassion, but there's also this thing about person-centeredness. So we want to develop person-centered practitioners. Person-centeredness is a very important term now. It is a term that is used within global health and recognized by the World Health Organization. And what is increasingly being recognized is that person-centered practice in medicine is more effective, so that you can tailor the way you practice to an individual person. Notice that it does not say patient. So we're thinking about the person behind the patient, very important part of family medicine. So that's the first goal. The second goal is to foster a global community, a global family medicine community that will contribute to the provision of primary healthcare and universal health coverage. One of the great advantages of our program is that it brings together students from all different parts of the world, and students that are working in different contexts, often within a primary care sort of setting. But what we have seen is that if we develop a community within the student population, then this has great benefits for learning, but also will benefit students beyond the end of the program. And developing a community of practice is part of something that we want to do in our program. Finally, we want to develop family medicine leaders. Although there is lots of emphasis around the world on the development of family medicine at the moment, in many countries, family medicine is still in its infancy, and so has not been developed fully as a medical specialty, and is not something that medical students generally want to, not a specialty that they want to go into. So there's a lot for our graduates to do in terms of leadership, advocacy for family medicine, and bringing about change to deliver quality family medicine locally, as well as influencing national or international policy or context. So that's what we're aiming for from our graduates. So we have aspirations for our graduates beyond just learning about family medicine. This is quite a busy slide, and I'm sorry if it's not projecting very well. You can increase the size of the slide if you go to the top of your screen. There's a there's a plus sign, excuse me, where you can zoom in. The reason that I present this slide is that it shows the structure of the program. And you will see that you can ignore the dates to start, because the precise dates are actually for the the program when it started in 2019, but you can look at the months and the timing of the year because that's still relevant. So you will see that it's a 3-year program consisting of 7 20-credit courses. Each course lasts for 11 weeks with a reading week in the middle. The final part of the study is a family medicine project, which lasts for from January until June in the final year. And that's an opportunity to carry out some independent study yourself. And what we normally would encourage you to do is a quality improvement project within your practice, but there's some flexibility within that. In the first year, we try to develop generic skills of family doctors. We start by establishing what family medicine is and some of the foundations of family practice. We then go on to discuss some of the principles of family medicine, including evidence-based practice, and that second course is actually being renamed Evidence-Based Practice in Family Medicine. So we look at the application of research evidence in clinical practice. And that includes an introduction to quality improvement, which is a very important theme throughout our program. The third course in the first year is called Professionalism in Family Practice and focuses on the professional side of practice with teaching on self-reflection, ethical practice, and other aspects of professionalism. In the second year, we try and develop the generic sort of learning that you have in the first year by referring more to clinical topics. And we cover non-communicable disease, maternal and child health, and a family medicine approach to patients with complex needs, which also covers mental health. Throughout the second year, as I said, we develop concepts that you learn in the first year, and we continue to develop important themes of our program, including leadership, quality improvement, good academic practice, for example. In the third year, you will start by doing a research methods course. The name of this course is actually going to change as well to methodologies within family medicine, but it looks at the application of research and quality improvement in clinical practice. And then it's time for your project. The program itself is almost 100% online. We do have an annual summer school where you can come to Edinburgh and learn face-to-face, but most of the study will be done online. The reason that we created this program in that way was to improve access for students around the world, because the program is really designed for students internationally. So we don't have a lot of students in the UK or in Europe. Most of our students join us from beyond that. The online approach is very flexible. You can learn anywhere at any time, and you can combine your learning with working. And we would encourage our students to try and integrate their learning with their clinical practice. So and to bring examples from their clinical practice to the teaching and learning. When we teach online, feedback and self-assessment processes are of a very high standard, and that's something that's very important in our program. We want to see you as a student progress as time goes on, and part of that is receiving feedback and improving your approach based on feedback. So there's a significant emphasis on feedback within our program. The other good thing about the online route to study is that we can utilize a lot of resources in that way. We can access a lot of expertise. So as well as students coming to us internationally, we can access international experts and allow them to teach on the program because it's online. And there's also access to a lot of university resources, such as the library, which is a great resource, but available fully online. So as a student of the university, not only do you have access to the program, but you will have access to lots of other resources within the broader university. Okay, I mentioned in talking about the last slide that there is an opportunity to have face-to-face teaching, and we do offer a summer school every year. This year will be the first time that the summer school has returned post-COVID, so we're looking forward to welcoming our students to Edinburgh for that period of teaching. It lasts for a week, and it's an opportunity to meet your classmates and to experience quite an intensive period of learning, which enhances the teaching on the program. This is not compulsory, so it's not credit bearing, and it doesn't disadvantage you in any way if you can't attend. This is purely an opportunity to meet your tutors, meet some of the professors that work within the university within family medicine, to meet your classmates and to actually visit Edinburgh and feel more part of the city and the university. That's a very important theme within our university, is local community engagement, and we would love to be able to welcome you to Edinburgh. The opportunity is available to all students across 3 years of the program, so you have 3 different years that you could attend if you wanted to. Okay, so that's a little bit about the program itself. If you're thinking of applying, then let's talk a little bit about the process of application. The first step is to go to our website, and the link to the website is there. I've shared it in the chat as well earlier on. I wonder if I can share it again. That's the link there. And then click on the how to apply section, which gives you detailed information about the application. What you will need to apply for the program is, first of all, a degree certificate. Most of the applicants for our program have primary medical degrees, such as MBCHB or MBBS, but we also accept onto the program allied health professionals, as long as they are working in a primary care setting and have clinical experience within a primary care setting. So for example, we have clinical officers, nurse practitioners, we've had paramedics, we've got a midwife currently studying with us. So lots of different allied health professionals as well as doctors, and that really enhances the community of practice. If you're an allied health professional, you must provide your primary degree, which is often a BSc, as part of your application. So we ask for the degree certificate and a transcript of the degree. So telling us your marks and your performance during your undergraduate degree. You need to write a personal statement about why you've chosen the program. And I assess these. So what I'm looking for in the personal statement is really a bit of understanding of who you are, why you want to study family medicine, and also your understanding of family medicine itself. This doesn't have to be very long or intensive. It's just something to give me an impression of who you are and your approach to academic studies in family medicine. The next thing is a signed and dated letter of reference on headed paper. I've highlighted signed and dated and headed paper because many of the references we receive do not get accepted by the university. So make sure that when you ask for a letter of reference, it follows these instructions. And if it's headed and signed and dated, and it's a recent letter as well, then it will be accepted. We ask for an English language certificate, so proof of English language proficiency that has been completed within the last 2 years. And if you want to look at the rules around English language certificates, then please look at the website because it's a bit more complicated, this one. Excuse me. For some students who have graduated from certain universities internationally that are recognized in terms of their teaching within the English language, those students will not need to provide an English language certificate, but only if their degree from that university is recent. So if you did your undergraduate degree 6 years ago, for example, then it won't be accepted as evidence of English language proficiency. And I think, again, the admissions team look for degrees within 2 or 3 years. But it's the admissions team that process this part of the application, not myself. So it's up to them to feed back to you about this. But it's the English language certificate is quite important to the university to ensure that you're able to start your studies. Okay. And although the Master of Family Medicine program is one program, there are 2 modes of study on the program. The first is normal study, where you sign up for the 3-year program and you take each course consecutively in sequence over the 3 years and you finish your master's degree. In this scenario, the way that you pay for your degree is that you pay each year. So you pay for 60% at the start of the year, then 40% halfway through the year. So that's the way that it's charged. There's another route, which is intermittent study. This is much more flexible. it means that you've got up to 6 years to complete the master's program, 2 years to complete each set of 3 courses. So you've got up to 2 years to complete the first 3 courses, up to 4 years to complete the first 4 courses, and up to 6 years to complete the full master's degree. If you apply for the ICL or intermittent study route, then you can start the program and then take a break if you want, without any consequence. So it's much more flexible. And a lot of our students like this option because you are billed per course. So the university charges you at the start of a course for that course, and then it only charges you again if you sign up for the subsequent course. So actually payments can be much more manageable in that way. So that's a good reason to sign up for that particular approach to the program. If you choose intermittent study, then you can still complete the program in 3 years, taking each course consecutively. That's no problem, but it does build in some flexibility. Okay, let's just take a break there. And I can see we've been joined by Dr. Kumar. Welcome, Dr. Kumar. My name's Robin Ramsey. I'm the Master of Family Medicine Program Co-Director. And welcome. And welcome, Dr. Balchan. Nice to see you. Doreen, I can see you've made a comment in the chat. Let me just see what your comment is. Okay, perfect. Thank you, Doreen. I hope you can stay with us for the rest of the session. And maybe I'll answer your question at the end if that's okay. Perfect. Okay. I wanted to go on and talk about scholarships because we have a number of scholarships available. The first scholarship is there are 2 scholarships actually, the East African Scholarship and the Carl and Gillian Kjeltsberg Scholarship. These are both scholarships that have been donated by independent donors. They are only for students from Africa. The East African Scholarship, as the name suggests, covers countries in East Africa only. But the Kjeltsberg Scholarship covers all of Africa. These are full scholarships covering all tuition. And for the application, we ask for a CV and a 500 to 800 word summary of your reasons for applying for the Master of Family Medicine. And what we're looking for in any application is a little bit about you and how you will, I guess it's your leadership potential that we're looking for. We mentioned that as one of the program goals, but we're looking to see your leadership potential and potential impact in your country of your studies in family medicine. So trying to think about how your studies might fit into the broader context of global health, but also how it may impact care for communities at a local level. And that's really what we're looking for. Applications for both these scholarships are closed on the 30th of June, and we have about 4 scholarships available in total for those 2. We also have the Commonwealth Distance Learning Scholarships available. Unfortunately, the application deadline for these has passed for this year. So we've already chosen our scholars for this year. But this is important to be aware of. And if you are applicable for a Commonwealth scholarship, you may want to actually think about applying again next year if that's something that you want to do. More details are available on the web link provided on the slide. These are full scholarships again, but are only available to students from Commonwealth countries. And it's quite competitive. So what I would say to you is that if you do need a scholarship to start studying, then think about applying for this next year. Communicate with our team in the meantime, and we will help you with your application. There are also a couple of scholarships that are available within the university that are relevant to our students. The Edinburgh Global Distance Learning Scholarship and the Glenmore Medical Online Postgraduate Scholarship. Now, although these are available, these are very competitive because they cover a number of different programs. So just be aware of that when applying for them. But these again will cover full tuition fees, and we can help you with any application that you make. So those are the scholarships. I just want to end this part of the talk by discussing opportunities for our students. We started by considering what the program wants to achieve for you, and when you finish the program, what we have seen from our graduates is that there are a number of opportunities available once you have completed your degree. Firstly, the Master of Family Medicine provides you with a globally recognised academic degree in family medicine. It demonstrates that you have studied to quite a high level of academic rigour within the family medicine specialty. And because the University of Edinburgh is a well-recognised Russell Group university, it is a degree that will help you with career development, or should help you with career development. Some of our students who are particularly interested in the academic side of family medicine will progress to study PhD, and a number of opportunities are available for that. Some of our alumni also join us as part of the teaching and tutoring team on the programme to gain teaching experience, and we would encourage that. We feel that that's very important as part of developing future leaders who can influence and impact practice. We need to have teachers and tutors of future generations of family doctors. So we will help you to gain experience as an educator. Along with our active community of practice within the programme, we promote connection to worldwide networks of family doctors, and most specifically through our WONCA network. So WONCA is the World Association of Family Doctors. We encourage our students to join WONCA working groups and to attend WONCA conferences and to benefit from that network. And finally, as I've mentioned before, there are opportunities within leadership and advocacy for family medicine, which is a different aspect or approach from the academic side or the teaching side. This is more about advocating and influencing policy for family medicine and trying to embed family medicine into health systems. So again, there's lots of opportunities for our students for this through our networks that we have. Okay, so that's the presentation or discussion on the program itself. For next steps, we would encourage you to attend or watch the recording of how to make an effective application. So that takes some of what I've said a bit further in trying to apply to the university. You can also hear what it's like to study online at one of our student and graduate panel sessions, where some of our students will discuss the part-time online master's route and how the benefits, but also the challenges of that. And if you have any questions after today, then you can chat to some of our current students via our Uni Buddy platform, and the link to that is on that